Also, starting January 1st, California will become the first state in the nation to offer health insurance to undocumented immigrants.
Under the expansion, more than 700,000 people between the ages of 26 and 49 will be eligible for Medi-Cal. CBS 8's Rocio de la Fe takes a look at the new law and how immigrant rights advocates are reacting.
Immigrant rights advocates call the expansion of health care for undocumented immigrants a major milestone in California.
This is a really major step in California.
Advocates for immigrant rights are celebrating a monumental victory in the fight for more inclusive health care.
I'm so grateful again. I think it's really, really important to think about how big of a precedent this is for the entire nation.
Nettie Velasquez is the border policy coordinator at Alliance San Diego. She's a DACA recipient who has been fighting and advocating for health expansion for years.
A lot of undocumented people and, a lot of low-income people, because they don't have access to these resources, they wait until the very end to hopefully receive some care, and by then it's too late. And we shouldn't have to have people, waiting until they're feeling ill to go to the doctor. We should have preventative care, and that's why this is so important.
Those who are eligible will be able to qualify for Medi-Cal, the state's health insurance program for low-income individuals. Medi-Cal offers access to primary and preventative care, specialists, prescription medicine, and more.
They also deserve a right to have access to primary needs that they don't generally have access to.
Undocumented people between the ages of 26 and 49 will be eligible for Medi-Cal. Velasquez says having access to health care is a necessity the immigrant community shouldn't have to put on hold.
I do think a lot of people for so long have literally been neglecting their health because it just hasn't been accessible to them.
California Republicans have argued that the state's Medi-Cal system could overload the state's budget. Velasquez says she thinks the state is moving in the right direction, but believes there's still more work to be done. That's because many undocumented Californians will still remain ineligible for Medi-Cal because they make too much money to qualify, but not enough to afford private insurance.
We really have to continue including more folks and to not kind of forget about the ones who just make a little bit over.
California will not use health care to share immigration information with federal officials. Rocio de la Fe, CBS 8.
So California will become the first state in the country to offer all undocumented immigrants health insurance starting next week. Big news there. New at 5, ABC 10 News reporter Austin Gravish shows us the impact and cost of the move.
Robert Vivar knows what it's like not to have health insurance. He spent years living in San Diego as an undocumented immigrant. In the new year, California will guarantee free health care to all low-income immigrants living in the state, regardless of their immigration status or age.
One of my big concerns was also, health care.
The state is doing this by adding an estimated 764,000 people aged 26 to 49 to Medi-Cal. That's the state's version of Medicaid for people with low incomes.
Everybody deserves to have medical health as a human right.
67-year-old Vivar is now an immigrant rights advocate and fights for deported veterans. He spends a lot of his time volunteering at the border helping migrants. Many are injured.
The majority of the health needs that we're seeing occurred from border wall falls.
Injured migrants are often taken to our ERs with serious injuries from border wall falls, but few return after the release for follow-up care because they don't have insurance. That could change in the new year, but at a cost to taxpayers. The expanded coverage is estimated to cost $2.6 billion every year. The California Senate Republican caucus criticized the move in an analysis of the governor's budget, saying Medi-Cal is already strained by serving 14.6 million residents, more than a third of the state's population, and that adding 764,000 people is going to exacerbate access problems. Vivar thinks while costly, expanding health care for all undocumented Californians is worth it.
The state will end up, saving money from reducing, long-term medical issues that some of the folks may experience.
The changes to Medi-Cal start January 1st. Austin Gravish, ABC 10 News.
Many undocumented Californians will still be ineligible for the Medi-Cal when the changes start in the new year. That's because many make too much money to qualify for the government program, but still cannot afford the cost of private insurance.
Starting Monday, undocumented immigrants will qualify for health insurance in the state. California is the first state to offer that help via Medi-Cal. That's the state's version of the federal Medicaid program for people with low incomes. About 700,000 people will be eligible as of January 1st.
Hello, I'm Mark Brown. Get more great ABC7 content by clicking the subscribe button for our YouTube channel and download the ABC7 Los Angeles streaming app on
night off. Governor Gavin Newsom signed this into law in 2022, but it's now just taking effect. And as CBS 8's Steve Price explains, while some San Diegans are applauding the new law, others fear it will have a devastating financial impact.
For those who qualify, California already provides Medi-Cal insurance for those who are 25 and younger and those who are 50 and above. This new law that goes into effect today fills that gap from 26 to 49. Local Republican leaders say we can't afford it, but supporters say this benefits everyone.
More than 700,000 undocumented immigrants are now eligible for Medi-Cal, and those fighting years to get this passed say this is a great day.
We're talking about individuals who clean our houses. We're talking about community members who have the lowest paying jobs.
The state's own analysis says this will cost California $2.6 billion when fully implemented.
The state already is going to be about $65 billion in debt.
County Supervisor Jim Desmond is one of several local Republican leaders who say this is not the time to be stretching our state's budget, especially when so many San Diegans are struggling to pay their bills.
A lot of us pay a lot of money for insurance, and it just seems to be kind of a slight to those that are working hard and providing and having to pay for their own insurance when somebody else gets it for free from just walking into the country.
But supporters of the new law say this will actually help San Diegans in multiple ways. For one, if people get preventative care, they're less likely to get really sick and end up later in our overcrowded emergency rooms.
If people are getting the right care at the right place and the right time, then that leads to a more efficient system for all of us. It's a less of a burden on the hospitals and clinics.
And they say if people around us are healthier, they're less likely to get us sick.
During COVID, we were all, we wanted everybody to get a vaccination. And we wanted that because it was integral to our collective health, right? And so our collective health is strengthened by this important milestone of Medi-Cal for all.
Desmond and El Cajon Mayor Bill Wells point out that 65,000 migrants have entered our region in the past 3 months, many of whom now qualify for health insurance, and they fear this new law will encourage even more people to enter California. Steve Price, CBS 8.
Second day of the 2024 legislative session is underway right now. KCRA3's Mike DeSalle highlights two topics already leading to two new proposals, including health care for undocumented immigrants and safeguards for artificial intelligence.
Day one of the legislative session here at the state capitol saw the release of two different proposals, one of them aimed at avoiding the repeat of what one lawmaker called the disaster of social media being unregulated. The other, something one lawmaker called unconscionable, given the state's budget deficit. So let's start with that one. Republican lawmaker Bill Asaley is proposing a new law to revoke funding for the state's first in the nation universal health care program for what he called illegal immigrants. The governor says he remains committed to that program, even at a cost of $4 billion to taxpayers at a time when the state is facing a $68 billion budget deficit. The other proposal comes from State Senator Steve Padilla, a Democrat. That would create a new ethical framework for any artificial intelligence provider who contracts with the state. He says the lack of action from Congress to set up similar guidelines and frameworks and guardrails for social media has created, in his word, an unregulated disaster. Now, both of these are just proposals at this point, so it's very early in the process. Don't know at this point whether either of these will progress far enough through the legislative process to come to a vote before all of the lawmakers. At the state capitol, Mike DeSalle, KCRA 3 News.